Hi, so it's been a long time that I have not filmed a video, and I was actually thinking about a few things that I could actually be filming for. But then I had a friend, she reached out to me saying that Vrinda, when I actually came to United States, it was very intimidating, and she mentioned she was a very shy and an introverted person to actually be working directly as a dental assistant, graduating from dental school from another country. It was just that the work environment was different, the culture was different, and I felt like, yes, I felt the same way. Not that I was a very confident person anyways, but I just felt like, it's still intimidating. Like, you're going to a new country, you don't know the people, you don't know their culture, and you have to start working. Like, in dental school, obviously you're taught about the skills and the knowledge, you're very efficient, like, in those aspects, but they're not teaching you how it's going to be in the work environment, and especially in a different country, and how to learn their culture. So this video is going to be about people who I feel like it's going to be most beneficial for people who want to come to the States, and this is because I'm telling you about my journey and what I learned up here. But definitely, it can be helpful for people who are already practicing in India or other countries, and maybe you can, pick those tiny tips and actually put it into your workplace. And after graduating from dental school, it does not have to be so intimidating to actually go into the work environment. And so let's get started. Okay, so the first thing I would do is to put the patient needs above yours, and it's just because, like, you're in this service-based industry. You always need to remember that you have to put the patient's needs above yours. I mean, obviously, you're gonna do that anyways, but it's just that every day I wake up and I'll be like, okay, how can I make some patient's experience really better? And it would be like, by it's very satisfying when someone says thank you, and be it another dental assistant, the patient themselves, or the dentist that I'm assisting. I just want to make sure that I am giving my best for them to um, get the best. Like, thank you, it's like, obviously it's just a courtesy of thank you, but you actually know when they mean it. And like, you'll see the smile on their face, and it's definitely through the eyes. You can definitely say that you did a really good job. So that's one thing. And the second thing would be that like, try to learn about the patient, listen to them. Most of the times we're involved in like, just knowing about why they came in for and stuff, which is obviously important because they're coming in here to get treated. But you still want to be listening to other things that they have to say, so that you can, like, pass the information to the dentist, or if you're a dentist, like, you can actually communicate with your dental assistant. The third thing I would bring up is the cultural competence, and that's a lot when you actually have to, change countries and understand their culture, because I feel in United States there are just so many different races and ethnicity you have. It's a very diverse culture. And in India, yes, it's diverse too, but you're still practicing in that state, and most of the times you've already been in that state. But the culture, there's a language better up there as well, and there's a language better up here as well. And so you just have to, like, understand, be like, okay, I mean, I would have never thought, like, when I was selecting my dental schools, I was thinking of taking somewhere, like, in South India. But the thing is, I didn't understand the language. Like, I was just wondering, how am I going to communicate? But then I see, like, few of my friends who were from the west part of India, they did do their dental school from the south, and I was asking their experience, and they did mention that, like, they had a little bit difficulty in understanding the language. Obviously they had someone translate it for them. But yeah, so those are the things, like, I when people speaking Spanish, you have someone who's translating for you. And you're little, you don't understand the importance of actually understanding people in a different language, but I feel like now I do. I am better with all those kind of stuff. But yeah, you have to remember about the different race and ethnicity. And I would also mention the level of hierarchy, because like dental offices, they were like small most of the times, and I don't even feel like there will be more than 50, even if it's a DSO. And it's just that, you have a dentist, you have a lab technician, you have a dental assistant, you have people in the front, you have an office manager, and yeah, that's it. But you have to remember the level of hierarchy up there, and respect each other anyways. It's just because you need to respect the dentist, and the dentist needs to respect you. And like, if you're dentist yourself, you need to make sure that you're respecting your dental assistants, because end of the day, they're helping you out a lot. If it was not for them, your work would not be so much easy. And I feel like I've been in both the places where you get to be a dentist and a dental assistant. And while working as a dental assistant, I feel like, yes, they actually, they do a lot of work. Like, when a dentist does then dental assistant work, you actually need to remind yourself that you're an assistant, and you have to assist the dentist. It's kind of weird when you, as a dentist, you're assisting a dental assistant going in a reverse manner. It's like, okay, you want to see the procedure, you're interested in the procedure, but you also want to make sure that, okay, what does the dentist need, and I want to assist them, like, passing on the instruments before they even think about the next step. So you want to make sure that you're following those kind of steps. So that's the third point. But let's go to the fourth point. And I love this. Like, when I was working in customer service up here, what I have actually learned is the best way to be connecting to people. If you are like, you're an introverted person, you don't know what to talk. Like the patients in your room, what do you talk next? So it could be about sports. Like, guys are a lot into sports, soccer, baseball, whatever. I don't know. I'm not into sports, but hardly I would know cricket. That's it. But I don't watch any sports. But yeah, so I just feel like you can talk about sports, and you can talk about food. You can talk, like, a lot of baking up here. Like, I feel like during Christmas, they talk a lot about baking stuff, eating different kind of foods, what they like. And that's a good place to start. And it could be their hobbies, what they do on the weekends. If they're like, if you feel like the patient can actually talk to you about it, then yeah, maybe that could be a conversation you can have. And then you can talk to them about their kids. Most of the time people are interested in their own family, so you can talk about their kids, their partners if they like. Then they're about their pets. Most of the people up here in states, they do have some of the other kind of pets, or maybe they want a pet. Or it's just like, try you need you need to try to know that person, because even they're just sitting in the chair waiting for the dentist and trying to be comfortable. Maybe it's their first experience in a dental office, or at a new location. And immigrants, like, they're also immigrants in states. And it maybe it's their first appointment, they're having a new dentist. Whatever the reason is, it's just that you're trying to make them comfortable as a patient and a dentist as well. Yeah, so I would suggest that. Then the fifth point would be that, you know um, people with disability, I feel like, when they come in, you need to you need to actually be asking them for permission to actually assist them first, before just doing, like, random stuff. Like, you actually need to ask them for permission. And most of the times, like, when I've seen people on wheelchair, you once they get into the chair, you want to ask them how to operate their wheelchair. And they're so nice and so kind. They would actually tell you how, you can put the wheelchair away, because you see, like, you have a dental chair, and then there's so much little space for the wheelchair to even get out, depending on your office, obviously. If it's a bigger space, you can take out the wheelchair, like, perfectly fine. But the electric ones, they're locked, so you want to make sure to unlock them, and then kind of whatever, play with that, ask them how to do it. They will they're very nice to, they will show how to actually, because they've been using it, right? So they know how to operate their chair. So it's good to ask them, like, that how do you actually use your chair. And that's another thing. And yeah, so the other thing is, I make sure whenever someone's going out, like, when you're taking alginate impressions, or like, assisting a dentist with the procedure, you want to make sure that the alginate is wiped off their face, because they didn't come into your clinic with that, and you want to make sure, like, you wipe it off. The best thing would do, I would always do is, wet some paper towel or something, and then wipe it, and then dry, wipe it with a dry paper towel again, or some napkin, whatever is available. And suction, I mean, I feel like when you're assisting, or when you're as the dentist, you want to make sure that you give them the suction, because I don't know, like, we keep telling them that, yeah, you can swallow it, but I feel like it's just like, but they want it out. So if it's their say, if they want it out, they want it out. And so try to be good with the suction. I know you have other things to do in the office, but it's just that you're taking care. Like, these are the tiny things that make you stand out. And, like, if you're good with all these stuff, they're gonna be like, thank you for taking care of me. And yeah, so I feel like that's also another way of taking care of them, actually showing them where the water comes from, and, like, showing them where things are, because we can't be like, okay, just go wash your face, the sink is out there. We sometimes, like, the sink operates differently, and then you have, like, I don't know, I feel like sometimes it's automatic, or you have to press a pedal, or if it's not that complicated, yes, maybe you can tell them. But like, if you see like an elderly patient, and you're just telling them, okay, just go wash your face and come back, and I feel like it's a little bit rude. You can at least walk with them to show them, just stand there, it's okay, like, just stand there, give them a napkin. It's just this, I feel like anybody could do this. It's not like you need to learn, but it's just the small details we don't even think that can help a patient. And it's so important. Like, it is important for the patient. So end of the day, the patient's important for us. So might as well just, like, help them out with all those things. Yeah. And then I want to move over to, be aware of your surroundings. So that's when you actually get an opportunity to, like, be helpful to your patients and your dentist and your dental assistants. Like, be aware of your surroundings all the time. The other big thing I would say is, when I started learning the XCP, like taking radiographs, the positionings, I feel like the more you're better in taking radiographs in like one go, that will be better for the patient and for yourself. And you're exposing the patient a little bit less to x-rays. So it's just helpful if you know that, and that's one good quality I feel like every dentist would need anyways. So yeah, be very efficient at it. There are YouTube videos on the positionings, and you already learn in school, but it's just that maybe you don't know how to use the portable ones, or some other kind of machines, definitely. So try to learn that. I would try to learn some softwares. Most of the softwares are color coded, and there's some different colors for the waiting room, that the patients are waiting in the waiting room. The patients are done with their procedures, or maybe it's time to call them in. So those are things that you can actually learn. And the I feel like the first week, as an assistant, what you should be doing is actually seeing where the materials are, because most of the time what they need are the materials. If you know where the materials are, 80% of your stuff is done. I mean, you can learn the sterilization and everything. That'll come with the flow. But if you know where the materials are, you can actually go grab them. You need to know where everything's arranged. Like, you need to, when in your downtime, you need to go see where everything is kept. How are they doing their procedures? Like, what are the instrumentations required for each and every procedure? What kind of doctors or dentists like the cotton rolls, or like, like the tiniest thing. I'll be like, okay, they need these many gauzes, or they need these many cotton rolls. They need a specific instrument for a specific procedure, and different dentists do work differently. And to know those details about each and every dentist that you're working with, that will help you stand out, and that will help you get a better recommendation letter too, because you are actually helping them. And like, you're learning as well, but you're actually helping them so much. Like, they don't even have to think about it. They know that the setup is right anyways. So yeah, I think that's a big one. You need to know about how, like, in each and every procedure, what are the things required, and then there you go, have the trace set up ready. But if you're already a dentist, yeah, congratulations, that's good. You still want to prepare your tray to the best. I feel like you need to have it laid down very nicely. I feel like the more clean you are, the better you can think. Because I don't know, if some people start throwing things away, I just feel like I can't think while doing the procedure itself. But that's me. But everyone's different. But yeah, you still want to remember that if you teach your dental assistants how you want things, they're just going to make your life easy. So you want to have very good relationship with your dental assistants too. And the other thing is like how to break that, um how to break that silence, or how to actually start mingling around in a new crowd or a new culture. The best way is food, and I've actually learned this from my mom too. The best way, we always have guests at home, and the best way to actually learn more about the person is get some food. Like, know their allergies obviously, but just like a simple thing, they have a festival, get involved in their festivals. um Christmas, Thanksgiving, whatever's coming up, because it's the time right now. But I would still get like something, like, that they want, that they like, who would not want free, like, just kind of food too, like, just get some food. I feel like that breaks the ice all the time. It works, at least. I mean, 20% of the time it works. You should. And there, it's like a work family anyways, so you should. And they would do that for you too. So I hope all of this helps you out. And definitely, there's like the next thing I want to do is actually have the insurance breakdown as well. Like, what you should be looking into the insurance verification forms. That could help the foreign trained dentist as well. If you're newly started, and the people who already know it, they're the best people to learn from. And I would say learn from each other. Like, learn from the other dentists, learn from the dental assistants, everybody that you meet. Try to learn something from them, because they bring so much value to your work anyways. And I hope you're a little bit more confident when you come to states or wherever you're going to. If you're diving deep into your, like, starting with your practice, you want to make sure that your patient comes first. And I that's what like, anytime if I have to go assist or do some procedure, I would be like, okay, my patient comes first, that's it. And that brings my energy up, and makes my day go good. That thank you, I love those thank yous, and it's like I'm doing the right thing. And yes, so thank you for watching my video as well.